Gentlemen, if you're watching this and you're over 60, I want you to take a slow breath with me for a moment. I'm Dr. Lena, a board-certified urologist. And before we talk about exercises or science, I want to talk about something more personal. Confidence, not the loud, flashy kind, but the quiet confidence you feel when your body responds the way you expect it to, especially in the bedroom. If you've noticed changes in erection, firmness, size, or stamina, I want you to know something right away. You are not broken. Your body is not failing you. It's adapting. And with the right guidance, it can improve. Over the years, I've sat across from thousands of men who lowered their voices when they talked about intimacy. Strong men, successful men, men who led families and businesses. And almost all of them asked the same question in different ways. Doctor, is this just aging, or can I do something about it? That question carries fear, frustration, and sometimes shame. And my answer has always been the same. Aging changes the body, yes, but decline is not inevitable, especially when it comes to sexual health. I want you to imagine for a moment what a strong erection really is. It's not just desire, it's not just hormones. It's blood flow, nerve signals, muscle coordination, and confidence all working together. When you were younger, these systems worked automatically. You didn't think about them. But as we age, circulation slows, nerves become less responsive, and certain muscles weaken. That doesn't mean the system is gone. It means it needs support. Today, I want to share a simple 3-minute daily exercise that addresses the root of erection strength and perceived size. And I want to be very clear and honest with you. This is not about miracle growth or unrealistic promises. This is about optimizing blood retention, firmness, and fullness, so your erections feel stronger, last longer, and look more substantial. For many men, that alone restores confidence they thought was lost forever. Let me tell you a quick story. A few years ago, a 68-year-old patient came into my office. He was healthy, active, and sharp, but he told me something that stuck with me. He said, "Doc, I still want intimacy, but my body doesn't show up the way my mind does. That disconnect can quietly damage relationships and self-esteem." We didn't start with devices. We started with understanding a group of muscles deep in your pelvis that most men never think about. These muscles support your bladder, prostate, and the base of the penis. They play a critical role in erections by controlling how blood enters and, more importantly, how it stays. When these muscles are weak, blood leaks out of the penis too quickly. That's when erections feel softer, smaller, and harder to maintain. When these muscles are strong and responsive, they act like a natural clamp, trapping blood where it belongs. This is where the 3-minute daily exercise comes in. You may have heard of pelvic floor exercises before, but most men are never taught how important they are for sexual performance. And many men do them incorrectly or inconsistently, which is why they think they don't work. When done correctly, these exercises improve firmness, enhance endurance, and increase the fullness of erections by maximizing blood pressure inside the erectile tissue. Before I explain how it works, let me ask you something. Have you ever noticed that? On your best days, erections feel thicker, stronger, and more reliable? That's not random. That's your pelvic muscles doing their job. Our goal is to make those good days your normal state again. The exercise itself is simple, but the impact is profound when you understand what you're doing. It starts with awareness. Right now, as you're listening, imagine gently lifting the muscles you would use to stop urination midstream. Not squeezing your stomach, not tightening your thighs, just a subtle internal lift. That's the foundation. That gentle lift is what supports erection strength at the base of the penis. When you train these muscles daily, you improve what we call venous occlusion. In plain language, that means your body gets better at keeping blood inside the penis during arousal. More trapped blood equals more firmness. More firmness often means erections appear larger and feel more powerful. This is not illusion. This is physics and physiology working together. I've seen men regain confidence not because their anatomy changed, but because their performance did. They stopped worrying. They stopped anticipating failure, and that mental shift alone further improved results. Sexual health is always a conversation between the body and the mind. Now, I want you to hear this clearly. This exercise works best when it becomes a calm daily ritual, not a stressful task. 3 minutes, that's it. No equipment, no pills, no pressure, just consistency. And when men commit to it, they often notice improved control within weeks, stronger morning erections, and better stamina during intimacy. As you're listening, I want you to ask yourself something honestly. What would it mean for your confidence if your body felt dependable again? If you didn't hesitate or worry before intimacy? That's what we're working toward here on Male Vitality Secrets. Real solutions, honest science, respect for where you are in life. In a moment, I'm going to walk you through exactly how to do this 3-in-1 routine safely and correctly. And I'll explain why each part matters for erection hardness and perceived size. But before we go there, I'd like you to do one small thing for me. If this conversation already feels different from what you usually hear, tap the like button and subscribe to Male Vitality Secrets. It helps this channel reach more men who need to hear this message, and it tells me to keep making content like this. And if you're comfortable, leave a comment below, just your age, and whether intimacy is something you still want to improve. You'd be surprised how many men are reading silently, thinking they're alone. Now, I'll guide you step by step through the exact 3-in-1 exercise, explain the science behind each phase, and show you how to avoid the mistakes that stop most men from seeing results. Stay with me. Now, let's slow this down and walk through the 3-minute routine together, calmly and clearly, the same way I explain it to my patients in my office. I want you to imagine I'm sitting right beside you, not rushing you, not judging you, just guiding you. This is not about forcing anything. It's about reconnecting with muscles your body has relied on your entire life, even if you've never consciously trained them. The first minute focuses on control and awareness. Gently lift your pelvic floor muscles, the same ones you would use to stop urine midstream. Hold that lift for about 3 to 5 seconds. You should feel a subtle upward engagement at the base of the penis, not a hard squeeze, then fully relax for the same amount of time. That relaxation matters more than most men realize. Blood flow improves when muscles can contract and release smoothly. Repeat this slow lift and release cycle for 1 full minute. This trains endurance and teaches your body how to support erections without tension. The second minute is about responsiveness. This is where many men notice changes in erection firmness over time. Quickly lift and release the pelvic floor muscles in a rhythmic, contour-old way. Think of it like gently tapping a switch on and off. There's no need to rush or strain, just clean, quick contractions followed by full release. This trains the muscles that respond during arousal and help maintain rigidity when stimulation increases. 1 minute here is enough. More is not better. Precision beats intensity every time. The third minute builds stamina. Gently lift the pelvic floor muscles and hold the contraction as long as you comfortably can without holding your breath. For most men starting out, that's around 10 seconds. Some may reach 15, then fully relax. Repeat this 3 or 4 times. This trains the muscles that help sustain erections during intimacy, not just achieve them. This is where many men report improved confidence because their body feels steadier and more reliable. That's the entire routine, 3 minutes. When done daily, it strengthens the exact muscles that support erection hardness and fullness. Now let's talk honestly about what this does and what it does not do. This exercise does not change your genetic anatomy. It does not magically grow tissue. What it does is improve blood trapping pressure and control. When blood stays inside the erectile chambers more efficiently, erections become firmer and often appear larger because they are fully engorged. For many men, that difference feels dramatic. There's also a powerful mental shift that happens when your body responds more consistently. Your mind relaxes, anxiety decreases, confidence rises, and that mental calm further improves performance. I've watched this cycle play out hundreds of times. Stronger erections lead to confidence, and confidence leads to stronger erections. It's a positive loop, and this exercise helps restart it. I want to pause here and ask you something personal. When was the last time you felt fully present and relaxed during intimacy without worrying about whether your body would cooperate? That feeling matters, and it's something you can work toward again, regardless of age. Now let's address common mistakes, because this is where many men unknowingly sabotage their progress. The first mistake is bearing down instead of lifting. You are not pushing. You are gently lifting upward. Pushing down increases pressure in the abdomen and actually weakens pelvic support. The second mistake is holding your breath. Always breathe normally. Holding your breath increases tension and reduces blood flow. The third mistake is using the wrong muscles. If your thighs, buttocks, or stomach tighten, reset and soften. This exercise should feel internal and controlled, not forced. Another mistake is overdoing it. More repetitions do not equal better results. These muscles respond best to consistent